Dr. Charles Svensson, MD. I did my medical school at University of South Alabama. I did my residency at East Carolina University in Greenville, North Carolina. I was in private practice in Birmingham for 15 years, and I've been here in Foley for 5 years. One of the things that I get asked a lot in the office and by patients almost on the street sometimes is bioidentical hormones. What are they? How do they work? Bioidentical hormones are hormones that are actually made by plants, not in a laboratory, not by horses' pregnant urine. They are actually the same identical hormones that the ovary produced. Well, a lot of perimenopausal women are in what they call an estrogen dominant state because they are not ovulating every month, and therefore they're creating a lot of estrogen every month, and they're not creating much progesterone. So therefore these women have very irregular periods, very long periods, breast tenderness, fatigue, weight gain, the list goes on and on. And the problem is they just do not ovulate every month like they did when they were in their 30s or their 40s. And therefore, they lack progesterone. And what you have to do is you have to give back the progesterone so that you can create a hormonal balance. A lot of research has shown that possibly testosterone has some type of responsibility for a woman's sex drive. And as she ages, the amount of testosterone the ovary produces decreases. And especially when she goes to menopause, it almost stops producing it completely. So therefore, adding back the testosterone certainly helps with that. I've seen that many times in a lot of my patients. A perfect candidate for bioidentical hormones or hormonal replacement is someone who is having very irregular periods, very unpredictable periods. Sometimes they may have 2 or 3 periods a month, or they may only have 1 period a year. But the first thing you need to do is to be tested for it. And the way we test that is the saliva test. When we test the saliva, what it's testing is just the free testosterone, free estrogen, and free progesterone. It tells us exactly how much of the free hormones is actually available for the cells to use. And therefore we can start replenishing that to get her feeling much more hormonally balanced. You can start seeing improvement within the first month or 2, easily. Well, I think it makes it certainly more tolerable for everybody because you're feeling so much better. You're feeling like you were when you were 25 years of age. You have more energy, you sleep better at night, you just feel better overall, you have more of a sex drive, you are energized, and you just feel 100% better. The compounding pharmacy that I use is Metastat. I've used them now for probably 2.5 years. I have known them to be very knowledgeable about hormones. The pharmacists there specialize in hormonal therapy. I trust when I write a prescription, I know the patient is getting what I write. And I think that's very encouraging and very comforting to know that the patient is getting exactly what we're writing.